Assalamu alaikum. I'm Dr. Waqas Ashraf. I'm a pain management specialist. I'm expert in interventional pain medicine. Today I'm going to talk about the sacroiliac joint dysfunction. Basically, dysfunction in the sacroiliac joint is also called as SI joint and can sometimes causes a lower back pain and or pain in the leg. Leg pain from SI joint dysfunction can be particularly difficult to differentiate from radiating leg pain caused by a lumbar disc herniation, which is also known as sciatica or sciatica, as they can feel quite similar. For decades, the sacroiliac joint was suspected as a common cause of lower back pain and the pain in the leg, although the difficulty in accurate diagnostic testing left many in the medical professions skeptical. Today, it is estimated that the sacroiliac joint connects is responsible for around 15% to 30% of the lower back pain cases. The triangular bone between the hip bones, which are called as iliac crest to the sacrum, this triangular bone between the lumbar spine and the tailbone coccyx is a joint which joins together is known as the SI joint or the sacroiliac joint. The primary function of the sacroiliac joint is to absorb shock between the upper body and the pelvis and the legs. The primary mechanism of SI joint dysfunction includes either the too much movement, which is called as hypermobility, or the instability of the sacroiliac joint, or too little movements like hypermobility and the fixation. Other than that, inflammation of the sacroiliac joint, which is called as sacroiliitis, can also produce the pelvic pain and the stiffness. Sacroiliac joint dysfunction may cause inflammation, and inflammation can lead to the pain. Sacroiliac joint dysfunction is more common in young and middle-aged women. Women who are pregnant or have recently given birth may be more susceptible to this pain, as it is very difficult to differentiate this pain from the radicular pain or the disc bulge pain. So the diagnostics is quite hard in that, and there is absolutely no diagnostic gold standard criteria for the sacroiliac joint. However, there are some diagnostic tests which can be performed on the patient to evaluate whether this is a sacroiliac joint pain or not. And initially, as I have been telling in all my videos, that we follow the WHO analgesic ladder, FDA guidelines and NICE guidelines. As per those, physical therapy and pharmacological treatment is the first line, in the second line of the treatment. And however, if it's not getting better, then it comes the interventional pain medicine. We have a couple of minimally invasive procedures which we do either by ultrasound guided or the live X-ray guided, cortisone, hyaluronic acid, PRP injections into the joint to ease the pain and to decrease the inflammation. And somehow there are some more advanced techniques which is called radiofrequency nerve ablations or radiofrequency neurotomies of the sacral nerves, which supplies to the SI joint, which gives a very comprehensive relief to the pain, not only to the pain but also helps in the mobility and the functional restoration, as our motto is to restore the function and to manage the pain and giving the quality of life to our patients. If you or any of your family and the friends is suffering from a similar pain, kindly do take an appointment for proper evaluation in the treatment process. Thank you.